Hello everybody. My name is Stefan Larsson. I used to be a medical doctor in the old days, but spent 25 years with the Boston Consulting Group, but have the last 10 years worked very actively with ICHOM, where I was a co-founder together with Michael Porter and Professor Martin Ingvar. I'm very happy to be here with you today to celebrate or contribute to the celebration of your 5-year anniversary. I was thinking a bit about when my kids turned 5. It's an interesting age. You know quite a lot of what you want when you're 5. You can be quite vocal, so you express what you want. You can be quite fast and agile. You get moving and you can get quite far very quickly. And you have a lot of impact on the environment around you. My kids had a lot of impact on us. I remember that very clearly. But you also have a lot more to achieve. You've just started. And I see of the Linnean Initiative in that way. And it so happens that you celebrate 5 years when ICHOM celebrates 10 years. And in fact, you met the first time when ICHOM celebrated 5. So there's an interesting coincidental connection there. But I wanted to start today with a reflection a little bit on healthcare and the role that the Linnean Initiative has had in Netherlands, but also, in fact, I would argue as an international role model. So the need for healthcare reform in Western medicine and in medicine and healthcare globally is imminent. And I think COVID-19 has showed us stronger than ever that we need to think differently about healthcare. And over the past year, I've worked on a book. And one of the things we're arguing in this book is that healthcare has 3 crises. One crisis of value. We spend more and more on healthcare, and yet when you look at some of the data, we are not getting more healthy life years in our populations. And both the OECD and WHO have argued that we waste 20 to 40% of the money we spend on healthcare. Secondly, we have a crisis of evidence. We spend more than ever on healthcare R&D, and yet we actually spend less and less on developing the evidence needed for clinical decision making. And this is at a time when we have more diagnostic and therapeutic options than ever. So we need more evidence, we need more guidance on the choices that clinicians face. And thirdly, we have a crisis of purpose. We have for many years, because of the cost crisis of healthcare and because of the complexity of the practice of medicine, seen growing stress, growing burnout, growing frustration among clinical staff. And I interviewed Francesca Colombo from the OECD just a few months ago. And she says her number one priority in healthcare is HR, the people crisis, or as we call it, the purpose crisis. So we need to think differently in healthcare. And healthcare is an extraordinarily complex thing to change. 30% of all data generated in the world today is healthcare related data. We have an industry with a large number of different stakeholders, providers, payers, pharma companies, medtech companies, and governments, who all have, as it seems, a different agenda, and oftentimes end up fighting each other or disagreeing. And so it's really hard to change. Oftentimes there's a gridlock because there's strong lobby groups arguing against change, although I would say everybody agrees that we need to change, we need to think differently. And leaders in healthcare in the future need to take 2 roles. One role is, of course, to make sure that their own organization succeeds, whether this is, the Erasmus University Hospital or it is one of the insurance companies. But the other role they need to have is to actually engage with others to help change the system. The government can't do this on their own. The payers can't do this on their own. We need to work together. And that's where the Linnean Group has come in and provided, I think, a really good and maybe the best example internationally on bringing the different stakeholders together. And there are many other nations who have done versions of this. Denmark has done work with the Minister of Health, Minister of Finance, and the regions to jointly think about how to change the system. In Singapore, there's quite a bit of work, often orchestrated by the ministry, but then engaging the leading hospitals and others. Australia, I spoke to just the other day, they are planning to try to bring together a group like the Linnean Group to drive the agenda of change in Australia. But the Linnean Group has been quite special because the Linnean Group was established, spontaneously. There wasn't really anybody who said, this group is needed and it should start. It came out of a shared passion for value-based healthcare as the roadmap for the future. And of course, you started at a meeting at the Dutch Embassy on Linnean Street in Washington. And then from there, during 5 years, you have worked together. And as I see it from the outside, there are a couple of success factors, key success factors that enable the Linnean Group to be very impactful. One is that you have been able to bring together a lot of deep expertise and very experienced individuals who've been willing to come there as individuals and not as representatives of a company or a ministry or a specific hospital. And by putting those, formal roles they have outside the meeting away, you've been able to orchestrate discussions that are based on experience and thoughtfulness and where vested interest is not at the center. I think this has been very important. The other one is that the people, or many of the 1,200 or so members, have been willing to engage in working groups to actually do actual work together. Because if you want to change payment models, or you want to change how you organize care, or if you want to establish national measurement of outcomes, you need to think about it quite a bit, and you need to bring various aspects together. And the working groups that the Linnean Group have put together have been, I think, very useful to provide input into the decision-making process. But that brings me to the third key success factor, which is the fact that the Linnean Group has stayed away from decision-making. You've been an influencer, you've brought your perspective to the table, but you've stayed away from decision-making, because as soon as you get into decision-making, then it's hard to be a neutral body of all these different interests together. So I think that's actually been very important. And I think, what you have achieved in 5 years has been to influence the direction of change. And there's, of course, many things that we still want to happen in the Dutch healthcare. I think the reform has just started, but I think the Linnean Group has a very important role to play if you maintain the neutrality, bring the right people together, and avoid, taking decisions, but providing input for those who take decisions. I think you can have a lot of influence going forward. So I want to, again, congratulate you on your 5-year birthday, but more importantly, congratulate you on the next 5 years, which I think will be even more important in how you can influence the improvement of Dutch healthcare. And I think there is a chance for Netherlands to actually develop the best healthcare in the world, because the changes that have started are extremely important, and many are struggling with the change, whereas you have gotten started in a very good way.